Good morning, everybody. We can go ahead and get started with this, the virtual town hall here, now that it is 11:30. This is Brett Norrell, President and CEO here at Holy Family Memorial. First off, I'd like to thank all of our employees during these very, very challenging times. We are blessed with wonderfully dedicated employees. I do understand that there are challenges related to the impact of COVID, and I want to thank all of you. Second, HFM has been impacted like a majority of hospitals in the nation. Decisions were made very early on in the COVID pandemic to pause all elective procedures and a majority of clinic visits, all in an effort to conserve our resources and support the physical distancing that was put out there by both the President and Governor Evers. So lastly, with the extension of the Governor's Safer at Home order for a second month, and the low prevalence of COVID in our county, we are considering the next steps needed for caring for our patients and the community. In just a moment, I will be asking Tom Vieser, Holy Family's Chief Financial Officer, to speak about these next steps for our patients and some of the procedures that have been delayed or put on hold. So I'd like to talk a little bit about the current financial state of Holy Family. And so, as I said, we've been impacted like a majority of other hospitals in the country, and really as a result of the pause of the elective procedures and clinic visits. And I want to remind everybody that this was not something that while we had a choice, we knew we needed to take steps to preserve resources and things like personal protective equipment, ICU beds, and the like. So, with that, we are right now, based on our current projections of just about a month in or so from the pausing of elective procedures and clinic visits, seeing a decline in net revenue of over $6 million per month when we compare that to our budget. As a result, we did unfortunately have to place some staff on leaves of absence. It's not a decision you take lightly. It's not an easy decision to make. But knowing the financial impact of not having revenue coming into the organization, we did have to make that decision. In addition, we worked with all of our vendors to either delay payments or restructure our contracts so we could try to lower our monthly expenses. In addition, we had an ask with our providers, and they all responded with a combination of reduction in paid time off, which improves our access later in the year, some taking unpaid days, others reducing dollars dedicated for continuing medical education, really a combination of all three of those. And I want to acknowledge them and say that is greatly appreciated for them to take that effort. I'm sure many of you are hearing about legislation that's out there, whether it's at the state level or at the federal level. And Holy Family, of course, is continuing to monitor all of that and try to understand what relief Holy Family will have. So I wanted to lay a few things out for all of our employees so they understand. Holy Family Memorial did take advantage of a program called the CMS Advanced Payment Program, in which it allowed us to get payment for Medicare patients in advance. It is essentially an interest-free loan that we do have to start paying back in approximately 128 days. So what this means is it gives us the cash today to help us weather some of this storm, but knowing we have to pay those dollars back later in the year. It was significant dollars, but again, as CMS will start taking those dollars back, it could have the impact later in the year. That was about $10 million or so in advance payment. The other, which I'm sure many of you have heard of, is a program called the CARES Act, or legislation called the CARES Act that was passed by the federal government. And in the initial package, there was approximately $100 billion that was set aside to support healthcare entities. So far, Holy Family, out of the first distribution of dollars, has received about $2.3 million of the CARES Act dollars that have been distributed. And that is essentially a grant. It's not something that Holy Family has to pay back. But I remind you that the impact we're seeing is approximately $6 million a month in the decline in revenue and procedures. So, and we don't necessarily anticipate a significantly more dollars coming out of those programs. And there's a number of reasons why. The way these dollars were identified to be distributed, initially it was just based on a hospital's Medicare volume. And the second round really looked at total net revenue of an organization, but peeled out a number of the buckets of that $100 billion for organizations that have seen a high prevalence of inpatient admissions, are in hot zones of outbreak like New York or California, Florida, or are also in rural communities, and we aren't designated as a rural hospital. So we continue to monitor these programs and try to take advantage of where we do qualify. I know Troy Day and the finance team are working hard to keep their finger on that, and where we are able to take advantage, we will do so. So I just wanted to talk a little bit about each of those programs and know that we are working hard to get past this piece of COVID and hopefully be able to get reimbursed for some of the additional dollars we had out there for preparation. So with that, I would like to transfer over to talk about really what is COVID in the community today, and talk a little bit about a surge plan if it was needed. So I'll hand over to either Dean or Tom.
Hi, this is Dean. So where we are today, let me back up a little bit to make sure everybody knows everything we've been doing. Incident Command, we opened on March 7th and has been meeting daily at 8 a.m. We've been on regional calls with every hospital in our region every day at 7 a.m. There's twice weekly calls with the county that we've been on to make sure that all of the EMS, the county health nurse, and the hospitals are all on the same page. We did convert half of our med surge floors. We've created a non-infectious end on the west side. The east side, we made negative pressure to house true COVID patients, and the in-between area we've made to be available for patients under investigation. As everybody knows, we did have to cut back on our elective surgeries and our elective non-essential clinic visits, but it's important to keep people healthy, manage their chronic conditions, so we're loosening up on that as we speak. We've implemented telemedicine as a way to take care of some of the patients and still keep them at home without having them out in the community. In our intensive care unit, we converted 4 rooms to negative pressure rooms in addition to the one that we already had. We started the respiratory clinic and made 3 negative pressure rooms over there at Harbortown with a separate entrance. We also are able to do drive-up testing. Now, it's not testing for everybody, it's people with respiratory symptoms, but that way they don't even have to come in the clinic. We can go out to their car and do the test there. Testing initially was very restricted. Essentially, you had to be hospitalized in the intensive care unit to get a test done. Now we can test anybody with respiratory symptoms. The tests are coming back between 24 hours and 7 days on average. So 7 days is too long. It'd be nice if they'd all be 24 hours. We do have the capability of doing some in-house testing now, but we can only do 35 total tests. So those have to be restricted on what needs the immediate turnaround compared to can we wait 24 hours from the state or up to 7 days from Quest. Where we stand today, there's been 11 cases in our county and 1 death. And so we have not been hit very hard in our county. Some of the testing done both in California and New York, looking for people who had it and didn't even know it. The New York study came out last week. Up to 13% of people tested positive, and they had no clue that they had COVID-19 or the disease. So there may be more in our county than we realize, but as Brett said, it seems that these are large cities with public transportation or population density that are getting hit a lot harder. I don't have much else on where we stand today.
Okay, thank you, Dean, for that. Next, I'd like to ask Tom Vieser to comment on the post-COVID surge plan, or what we are discussing is return of medically necessary time-sensitive procedures. So please, Tom.
Good morning, everyone. Nice to provide an update to everybody. First off, we've been watching much of the information in our the Northeast Wisconsin region meeting, also following Vizient, as well as the American College of Surgeons, to help us formulate a plan that is effective to balance the safety between our patients, our community, and of course our staff and providers. So the best care for our patients balanced with safety is what's really driven the plan I'm about to outline. During the early stages of the COVID-19, everything was geared around being ready for a surge and protecting our PPE equipment. As we have 6+ weeks going into this process, we have a fairly good idea how we're managing our PE. We have several new processes, so the PE in general is not a concern. As we've watched throughout the county and the state looking at our ICU beds, we feel we have a plan that will very effectively manage our ICU as well as the rest of our hospital bed capacity and our patient care provider capacity. We've taken the extra safety measures of masking, temperature checks, and negative pressure rooms at both the hospital and the Harbortown campus, as Dina outlined. As a result, our facilities are as safe, if not safer, than they have ever been as it relates to a pandemic type of response. We are addressing the needs as follows, applying scrutiny to the patients that need, for the patient's needs as it relates to any potential risk for the patient. So first, we continue to provide telemedicine, and then we prioritize our cancer patients, pregnant women, and others with chronic or urgent conditions to be seen in the provider office and ensure their care is maintained. Then as we looked at our postponed surgeries, many of our patients at the beginning of the COVID-19 continue to be on delay and if we continue the delay, will cause some potential detrimental issues for some of these individuals. Therefore, following a protocol, again, learned from the American College of Surgeons, we formed a committee of physicians that reviewed all of our postponed surgeries. We are currently in contact with individuals who are scheduled for surgery prior to the COVID-19 restrictions being put in place. And our goal is to take care of them first and make sure that they're willing to come to us for care. Once they've identified as having a medically necessary and time-sensitive need for a surgery, we contact them and ensure that they have not had contact with anybody who's had COVID-19 or traveled outside of the county in the past 14 days. And then if they are comfortable proceeding with their planned procedure, we then start to set up the next steps for getting them ready. The patients who will be selected are generally in good health who can return home after surgery and not in need of a skilled nursing care facility. That continues to be a difficult place to get patients admitted to, so we will, for a period of time, be very selective on the surgeries that can be done because it will be very difficult to get them placed if that is necessary. Patients whose surgeries are medically necessary and time sensitive but need assistance managing conditions such as diabetes and high blood pressure, we will have worked through the Holy Family Memorial Prepare Clinic and to manage their conditions prior to their surgery being scheduled. And the Prepare Clinic helps our patients optimize their health prior to surgery to obtain the best outcomes and a faster recovery. Also, diagnostic procedures are also being performed at this time as is medically necessary, as well as massage therapy and rehabilitation services. We feel it's very important that we continue the business of healthcare with additional precautions around the COVID-19, and look forward to serving our patients and our community.
All right, thank you, Tom. I believe those are all the updates we have for today. I will say that as we begin to go back to doing some of these elective procedures and visits, your respective leaders and executive directors are managing the process in each of the areas, and we'll be in touch with you. If you are currently on leave, we'll be in touch with you regarding returning at the time it is appropriate. You know, we are a strong organization, and I'm confident that we will overcome this current challenge, just like we have overcome similar challenges over our 120-year history. Each day, I want to let you know that the leadership here is in constant communication and conversation, not only internally with each other, but regionally to make sure we're aligned. We're monitoring the current guidelines from the federal government and the CDC and the local health departments to make sure that our patients are safe, our visitors are safe, and those in the community, if we can help them to have accurate information, we will do that as well. So with that, we're going to wrap this up and allow for any questions to be asked from anybody on the line. What you would need to do in order to ask a question is simply hit *6 on your phone to unmute, and then you can go ahead and ask your question, and we will do our best to answer those. If we do not have an answer today, I know we have Patty Glazer here helping capture questions, and we'll be able to get information out. I also believe that we are recording this, and we'll have it posted for others who aren't able to join us today to be able to listen to. So with that, if there are any questions, please go ahead and ask. Okay, so here's what I will offer, knowing that there aren't questions right now, is if something does happen to cross your mind, please don't hesitate to email me or one of the members of the senior team or your executive director or manager. You know, if we can answer your questions, we will certainly do that. If not, we'll find the right resource and be able to get you the answer that you desire. So with that, I'm going to say thank you, and we will go ahead and end this virtual town hall, and we look forward to seeing all of you back very soon. Thank you.